Doing really well here, Neil. And you?
Fantastic. Today's topic, why you need my book, Pregnancy Your Way. You've written a prenatal and postpartum book. What's the name?
Pregnancy Your Way. Choose a safe and happy birth. And it's available on Amazon and Barnes& and Noble.
Why did you choose that name?
Well, we thought about the title for a long time, Neil. But what we want to do is give moms and dads the knowledge they need to enable to choose and direct or steer their pregnancy. So we want to promote personal autonomy, responsibility, choice. So you can choose the kind of pregnancy you want 95% of the time.
What do you mean when you tell a mom that she can choose her pregnancy outcome?
Well, that means again that she has choices, and we want to make sure that all of our moms know that they can participate actively. For example, if they read the book, they'll discover what to eat. We'll talk about managing hypertension, how to avoid eclampsia, how to manage preeclampsia, how to avoid having a stroke, avoid depression and suicide, and learn to watch about baby's health.
Why is managing high blood pressure in pregnancy a key factor in health, pregnancy, and birth?
Well, blood pressure is really important. And as a matter of fact, I think it's so important that I would say um, it's what has really helped me to deliver 6,000 moms without having a maternal death. 10 to 15% of maternal deaths worldwide are due to some kind of problem with hypertension. So um, we want moms to learn the first signs of hypertension, and that's a one elevated blood pressure.
What kind of complications might you anticipate for a patient who develops high blood pressure at 30 weeks?
Well, Neil, that's a good question. Even a slight increase in blood pressure can uh, cause preeclampsia, seizures, liver failure, kidney failure, and even a stroke if blood pressure continues to rise.
How many patients have you delivered, and have you ever had a patient with a complication from hypertension?
No, I haven't. I've delivered about 6,000 moms with no maternal mortality. And as we talk about in the book, Pregnancy Your Way, I've accomplished this by watching blood pressure very carefully and managing it actively with moms at home.
What's the difference between high blood pressure and preeclampsia?
Well, high blood pressure can occur either before pregnancy or during pregnancy. Preeclampsia is just related to pregnancy, and it also has other factors. For example, you can have brisk reflexes. Those are too active. You have some blood abnormalities. You have protein in the urine. So there's a lot of difference between high blood pressure and preeclampsia.
Some people say that high blood pressure and preeclampsia occur suddenly and surprisingly. What do you think?
To tell you the truth, I learned a long time ago that that's not true. For the most part, again, this is our themes throughout the book that moms can choose their pregnancy outcomes. So it's one high blood pressure. That's there's usually one. Often it goes down again, but you have to pay attention to the first high blood pressure and you have to manage that. And if you do that, there's nothing really that's surprising about either high blood pressure or preeclampsia.
What advice do you have for managing high blood pressure during pregnancy?
Well, again, there's the first high blood pressure. I sometimes call that the herald sign or the canary in the coal mine. And the thing about it is, and we are all taught this, doctors, nurses, midwives, we get a high blood pressure, we check it again. As a matter of fact, I recently did a Google search on this, and they're still saying that. If you get a high blood pressure, recheck it. That is a real problem. And again, that it's the one high blood pressure that is the thing you need to pay attention to.
What are two kinds of high blood pressure during pregnancy?
Well, there's the pre-existing or the chronic high blood pressure, and then there's the pregnancy-induced blood pressure.
What is the blood pressure numbers for diagnosing mild chronic hypertension during pregnancy?
It is usually the top number is 140 to 160. That's the systolic, and the bottom number is 90 to 100. Personally, I think that these um, numbers are a little bit too high, and I would treat before we get to. I mean, I'd pay more attention to the 140 over 90. By the time they get to 160 over 100, I think that's too high and should have been treated.
How would you treat these blood pressures?
Well, years ago, we used to use Aldomet. Um, So I have had patients come in with chronic hypertension, like 135 over 90, who did well on Eldomet, and I've had others who started pregnancy at 100 over 50 and who got severe preeclampsia. So um, not everybody's the same, and that's a take-home story for patients. Everybody needs to be managed according to their blood pressure.
All right, the best place to go is world.allen.com and pick up Pregnancy Your Way available on Amazon.